Tied up in my Brittany mic there, but we got it sorted. So good to see you all. I think we're just going to start with a little question for you guys to consider. So I want you to think about what are the ideas about sexual pleasure that you remember from when you were growing up. So have a little think. What are the ideas that you remember? Because regardless of whether or not it was actually discussed out loud, there is a very good chance that you were given some indication about whether feeling good from sexual experiences was something for you to be celebrating or something to be silenced. Or maybe a bit of both, maybe celebrated for certain demographics and silenced for others. So just keep those ideas in mind for the next couple of minutes, particularly for my stories about people like Sarah. So Sarah is a really wonderful woman that I got to work with last year. She kindly took part in an upcoming initiative that I'm working on called Sex Cancer Ireland. Kind of does what it says on the tin. It is for people who are looking for relevant information for their sexual experiences after a cancer diagnosis or treatment, specifically for people who are from or based in Ireland. And I started developing that work with a group called the Pleasure Project, who I will tell you about in a little while, but for now, back to Sarah. So a really fabulous woman. She had been with her partner Pat for about 15 years. And she had gone through a really rough period with cancer treatment. There had been breast reconstruction surgery. And she had also had medically induced menopause from that treatment. So for herself and Pat, there was no real qualms in terms of their sexual attraction and the connection that way. It was rooted in a lot more than the physical at that point. But what did cause an issue was creating pleasure in what Sarah was calling her new body. So her response to physical touch had changed. So all of the sexual patterns that she'd built up for years, that they had built up for years, they weren't working anymore. So they had to try and relearn each other's bodies, and they had to figure out all of these changes on their own, because at no point during any of her appointments, any of her consultations, treatment, had anyone asked or advised about changes to her sex life. So they were going through that by themselves. And I suppose for Sarah and Pat, they found that communication, which is something that they did really, really well, and being able to grow together as partners, that also helped. But what would have been a really powerful anchor would have been if they had had that acknowledgement and some guidance along the way, because I suppose any big life changes, including illness, it can bring out previously unknown aspects to your personality, right? So you might find that you had this great strength that you didn't even know you had, or you might find that you're a bit more ruthless in going after what you want in life, or you might find that you're feeling incredibly lonely, that you have been left with all of these changes to some of the most important intimate relationships in your life, and you have no acknowledgement of it and no guidance on how to adapt to those changes. Now, we know that for a lot of people, poor sexual satisfaction can mean poor relationship satisfaction, and we know that over time, poor relationship satisfaction is highly associated with poor physical and psychosocial health outcomes. And that was certainly the case for another one of my clients called Rob. Really lovely guy. He's 26, kind, chatty, intelligent. He had had a couple of romantic relationships, but he was scared of dating because he knew that when he was any bit nervous, if some kind of partnered sexual activity began, there was very little chance that he would maintain an erection. Now, that was also the case when he was after a few pints, but that's a story for another day. He was coming to me to talk about that nervousness that he would get when he was starting dating. So Rob knows that he could be in his ideal situation. He could be with his ideal partner, and if any kind of partnered activity begins, the stress starts. Now, what Rob didn't know was that the stress that's there is perpetuating the sexual function issues. It's perpetuating the cycle. So he can't stay present in the moment because his brain is going to all the negative memories that he has of like an ex-partner saying something like, "What's wrong with you? Why isn't it happening?" Or, "What's wrong with me? Do you not find me attractive?" So the mental spiraling starts then for Rob. And he's thinking of all of the pressure and certainly the lack of sexual pleasure going on in those moments. So there's no way he's able to be present. And so what's happening there in the brain and in the body is the stress response. So our brain, the caveman brain, hasn't evolved that far. It can't tell the difference between a stress that might lead to shame and a stress that might lead to life or death situation. So it's just going into the same survival response. So for Rob, his brain is going, oh God, we need to sort it out. Is it not going to work? Thinking of the ex-partners. Is something wrong with you? And that's where the brain is going for him and taking him out of the moment, okay? But apart from the evolutionary survival aspect of sexual function issues, Rob and his former partners have also never really been taught about pleasure in a very healthy way, okay? So they've been taught that sex equals penetration, that all other kind of sexual touch is foreplay, so major miseducation going on there. If we were to paraphrase the words of Dr. Laurie Mintz, if we really prioritised women's pleasure a bit more, we would probably call all of the foreplay activities sex and call the penetration post-play. But like many of us, Rob and his former partners had never been taught any of this. They had been taught that sex is final destination of penetration and orgasm, and we have to get there looking as sexy and cool as we possibly can. So yeah, not a great education going on for them with pleasure. Now, speaking of pleasure, the Pleasure Project, who I mentioned earlier, they published a really fabulous systematic review in 2022 with the World Health Organization. And it found that incorporating pleasure promotion into our sexual health care can help prevent the transmission of sexually transmitted infections and HIV. So pleasure promotion is a really, really powerful tool for healthcare, and we need to be keeping that in mind. It has such strong impact. And I think we kind of forget, or maybe we avoid the fact that our bodies are built for pleasure. They're wired for pleasure, right? So when we don't do a great job of promoting all of the pleasure-filled nerve endings that we have, or the scientifically proven need for physical connection and touch, we're also forgetting about and not doing a great job of promoting a key element of pleasure, which is safety. So in order to create physical and emotional safety, we need consent. And in order to have true sexual consent, we need to understand our own body. So thankfully, we do hear a lot more talk these days about sexual violence prevention, which is so imperative. We also need to be encouraging and educating people to understand their body and its desires and pleasures and boundaries. That requires pleasure promotion. Because if we don't give people examples of how and why to be prioritizing their own pleasure, they are much less likely to be confident and respectful in saying things like, oh, I'd like more of that. Or, oh, I thought that would feel good, but it doesn't. Let's stop. Or would you like more of this? Now, of the 200 plus reasons that researchers have found for why people have sex, up at the top of that list is, any guesses? Pleasure. Very good. We got some very nervous whispers there. Pleasure. So we're forgetting about a key element of why people might want to consent to something in the first place. Okay, a lot of the time it's to feel good, and we need to be keeping that in mind when it comes to our healthcare strategies and our conversations with our clients. And like the teenagers that I teach tell me, you know, when I'm talking about pleasure and bodies, I'll ask them, why do they find it so funny or so embarrassing? And they say it's because it's awkward, and I'll say, okay, why is it awkward? And they'll say, it's because I've never heard someone discuss it openly or in a relaxed way or tell me that it's actually important for my well-being, you know? So like I do with Rob and with teenagers, I'll invite you all to take an inhale of breath now with me, and a big sigh on your exhale. Beautiful. And just take a mental note of what words or points so far have given you that little bit of cringe, okay? Maybe the whole 10 minutes so far has just mortified you. But just take a mental note and just, we're still here, right? We're still learning, we're still listening, we're still discussing pleasure, even with that bit of cringe there. So we don't have to get rid of the cringe, we can still have the conversation, it can be done, and it's worth having. And I suppose just like, yeah, the teenagers will say to me, if the person in authority, the leaders, if they don't bring it up, then they find it impossible to discuss pleasure. They find it impossible to ask those burning questions, right? Like, am I normal? Is there something wrong with me? Is it going to be like this forever? The same kind of questions that Sarah had, that her partner Pat had, that Rob and his former partners had. So what I would ask you to do is, if you're providing any kind of guidance, whether it's with students, patients, clients, whole communities, that you could be a pleasure promotion leader if there are conversations coming up about health and well-being, because we know that good health requires sexual well-being, and that generally sexual well-being requires safety and pleasure. So why is it still being overlooked and dismissed? I know there's that awkwardness there, or maybe it's just habit sometimes, but somebody has to do it, and if you're in a position to be that pleasure promotion leader, please do. Whether it's in a GP office, with the oncologist, with the counsellor, with the public representative, we all have a part to play in better health outcomes, and that means that we have a part to play in pleasure promotion. And reminder, again, for you to take forward is that our bodies are built for pleasure. They are wired for pleasure. So we might as well be enjoying them. Thank you.